Well, hello everyone. Welcome to Conversations on Care, a Facebook talk show bringing together service providers, clients, caregivers to help families better understand and cope with aging parents and chronic care needs. My name is Julie Colada, and I'm the founder and president of Open Arms Solutions, senior care agency serving the Chicagoland area, specializing in inspired, holistic dementia care. It's our mission to help you through this journey and to know that your loved one is living their best life possible. If you find these sessions and dialogues helpful, we would so appreciate you giving us a like and a share so that this will reach more people. If you have any questions or topics you'd like to learn more about, please write them in the comments below, and we'll make sure to review all the comments. Today's topic is a nurse's role and importance in delivering quality home care. And we thought this was a very timely topic, as this is National Nurses Week. And with me today, I'm very happy and proud to say, is our own Rachel Harris, who's our operations and nursing manager. Welcome, Rachel. Thank you so much for being on the program. So happy you're here.
Excited to be here.
So, Rachel, tell us about your background, and let's just start there. I think that's a really, nurses are incredibly important, special people. It's what inspired you to get into nursing?
So I grew up with a dad who was a CPA, loved mathematics. I had a mom who was in healthcare, not in nursing, but was an ultrasound tech. So I grew up kind of in the hospital system. I would get to go on the weekends and all the techs would test the machines on me. So I knew English was not going to be my major at the end of college. It was probably
Wait, did you say that all the techs tested their machines on you?
Oh, yeah. I mean, when guidelines were much looser back in the day and you needed to practice on the new machine that the ultrasound techs have, my mom would take me down to the hospital and they'd come in and practice. It was like their own clinical. So
oh, that's great.
It was a good time. I loved the hospital, oddly enough. I don't think most kids do. But I knew I was going to be in a math or science kind of career path, just based on that. And I have my youngest sister actually has a genetic disorder, an eating disorder. So I had a little bit of a different upbringing and unconventional childhood with having that. And so that really opened my eyes up to care teams, the healthcare system, an interest in kind of the body and science of it. So I decided nursing was a great, stable career path. I loved science, and that's kind of what drew me to nursing school. There's a lot of people that go through nursing school and partway through it realize, I don't love needles. I don't love doing this. I'm going to change my major. I got into nursing school and absolutely loved it. I had this big vision for being super clinical. I was going to be in anesthesiology afterward, and all these years of school. And I finished part of my degree and realized that anesthesiology really doesn't let you interact with people that much. Most of your patients are asleep behind a curtain, and you're just, sitting there doing some numbers. And so I really realized how much I love the patient care aspect, the camaraderie of a team aspect, and that's what drew me into my current career path, which is a little less clinical based, where I'm here at Open Arms. So kind of after school, I got right into that home care side of nursing, where I wasn't a floor nurse, I wasn't super clinical, but I really got to embrace the team aspect of nursing, the educational aspect that nursing brings. And so I've been with Open Arms for the last just over 4 years now, had a couple different roles, in the company, which I think we'll talk about, but definitely got to do a little bit of everything from a nursing aspect.
That's great, Rachel. It's amazing. It's been 4 years. Like everything, it's just time is flying by faster and faster. So can you share for a lot of people, I think, watching really don't have a concept as to what's involved in getting a nursing degree? Because it's pretty significant, and it's very significant effort. So share with us.
Yeah, there's, a couple different routes that you can go to get a nursing degree in different levels, depending on, what commitment you're able to make school-wise, time-wise. And so you traditionally hear of a nurse as an RN, and that is a 2-year degree where you have your clinical aspect of it, you're going to take your nursing boards, and you're a licensed nurse. Now, one step above that you'll hear is a nurse that is an RN BSN, so a nurse with a bachelor's degree. And that's going to be a full 4-year program. A lot of times now you're going to hear that most nurses do have a BSN, especially in a clinical setting. It's something that hospitals are trending towards to have certain statuses. They need to have enough nurses with a bachelor's because it adds such a level of research base. So to be able to better support that evidence-based practice. And then on the lower end, you have what's called an LPN, a licensed practical nurse. And so that's less than a 2-year degree, but you do have to have oversight from an actual licensed RN. So if you're interested in nursing, there's a lot of different options to get into it. You don't have to go straight off the bat to a 4-year program, if you don't have the availability to make that commitment. But yeah, you can be a nurse with many different degrees, 1-ish to 4 years or more after that.
Yeah, that's great. That's helpful. And a nursing degree involves a lot of. Can you just go into some of the topics, the anatomy of the body? I mean, a lot of it, especially when you get to the RN level. I mean, you're studying a lot of the same things that doctors are.
Yeah,
and so it's a significant, it's a significant degree with a whole lot of effort required. So why don't you share some of that?
Yeah. In any one of the degrees, you're going to have a very intense anatomy that you're learning of the body. I remember that being one of the toughest classes. You have 1 semester and you're learning every fine detail of how every system in the body works. So a real intricate learning of that. And then you've got some physiology in there. We have a lot of ethical classes that we take as well, ethics in healthcare. A big one too that you're going to see a lot in nursing school is pharmacology. Where you really, really, really have an in-depth learning of, medication management, and not just, oh, this is what this blood pressure medication is, but really a true clinical understanding of these are the medications, this is how the body processes that medication, these are side effects that you could have with that medication, these are some adverse side effects, that you could have that are really severe. Interactions. And then you also have, the hands-on technical aspect of nursing school, which personally was my favorite. I love reading a textbook, as does every other person that's going through school. But I really love the hands-on aspect of nursing, where you've got fundamentals, you're wetting your feet, you're getting into probably a clinical setting similar to what we in this business are used to. You're in a skilled nursing facility. You're working with geriatric patients. You've got med surg where you're in a hospital. You've got really critical care patients. No matter what area of nursing you want to go into, you learn it all. You've got obstetrics, you've got pediatrics. So you do it all, and you really have an intense learning of, the body, how to care for patients, how to provide comforting bedside care. I think that is something that, nurses are really known for. You hear, my nurse was so sweet when she came, and she was so nurturing. She made me feel so safe, in the hospital. And so that's something in nursing school that they teach you as well, is how to provide that comfort, not just looking at what somebody's vital signs are, how to make them feel, safe and well cared for. So it's an intense couple years, no matter what program that you do, but you leave with a wealth of knowledge that you then get to, hopefully go and use in practice and continue to expand on.
Thanks, Rachel. That was great. And, this past year with the pandemic, nurses have been just front and center, as have other healthcare workers and our caregivers, but, we have some nurses that are in senior living communities that were just frontline with that pandemic. And, the thing that has absolutely, and I hope some of our other nurse managers and nurses on our team are watching, I am so proud of how caring, truly caring and empathetic and just being there to comfort the residents in the communities that they're in. So we'll be talking more about that. So you made reference to this. We've started to talk about it. Nurses play so many different roles in different parts of healthcare, right? You just referenced the hospitals, and obviously hospitals are where we call acute care, which means the highest level of care, where people are dealing with serious chronic conditions and illnesses, surgeries. So clearly the nurses there are so important and vital in assisting doctors and attending to patients. And then there's something called the skilled nursing facilities that I think you referenced. Sometimes in healthcare, that's called subacute, meaning it's not the acute, it's not the hospital level, but many people, after they get discharged from a hospital, aren't ready to go home yet. They need more nursing care. They need more therapy care. And nurses play a key role in skilled nursing. They also play a key role in assisted living communities, and in senior communities, doctors' offices, and hospice. So obviously a wide range of places where nurses are so important. You started your career at Open Arms 4 years ago as a nurse community manager. And so tell us about that. What is a nurse doing? And in this community that you were in, it was independent living. It was not assisted living. It was not skilled rehab. And for some of you that are watching, assisted living is really a community, independent living is really a place where seniors live in their apartments, but often there are resources available to them if they need some extra help. So tell us about your role, Rachel, there.
Yeah, so as you mentioned, it was an independent living community. What I quickly learned in that industry is that the definition of independence doesn't always mean you're truly doing everything on your own and you don't need any assistance. So there were a lot of residents there that we could provide help to, not necessarily traditional clinical nursing help, which I'll get into. But my role there as the community nurse manager was to not only oversee our nursing clients and their nursing care, but I was also really involved in just patient care as a whole, or we call them clients, not patients, because we're not in that acute or subacute setting, where I'm doing those assessments. And because I have a clinical, nursing background, I'm able to really dig a little deeper on that assessment, put together a full care plan, and guide the family on maybe what mom or dad needs to support them that our caregivers can do on a daily or less frequently basis. And then the ongoing management of that. If you weren't a nursing client, you had a care coordinator that traditionally oversaw your care and was your, direct support. But I was very involved with them, helping guide them if, we were noticing change of conditions or, maybe a slight decline, and being able to really look at that care plan from a clinical aspect and say, hey, I think we need to, suggest this to the family, offer a little bit more care with, this activity of daily living. And there was a lot of education that I was able to do in that role, from making sure that our caregivers had all the training and background that they needed to be able to provide care to all of our residents and to our care coordinators. So it was a little bit of everything, which was really fun.
Yeah. And, one of the things I remember, in independent living communities, you have such an opportunity to really get to know the residents and be there for them and support them. And I know when I would pop into that particular community and you were there, it was very evident to me how loved you were there, how everyone, and the whole team. But from a nurse perspective, that's very clear. So let's talk a little bit more about home care specifically. Mm-hmm. And let's talk a little bit about, and this is very confusing to people, and often healthcare professionals get confused about this, which is that there are 3 different licenses for home care under our licensing body, which is the Illinois Department of Public Health, IDPH. And I think for anyone who's listening that didn't know that, the fact that IDPH has licenses for home care, just like they have licenses for assisted living and skilled nursing and hospitals, mm-hmm. They also have licenses for quality home care. And they offer 3 licenses. Home health care, and I'm going to have you help me describe these. Home health care, which is skilled care, nursing care, rehab therapies, physical therapy, occupational therapy, speech therapy, which is paid by Medicare. Home services is the second license, and that allows caregivers to support people's activities of daily living. And then the third license is something called private duty nursing, I don't know why there's not a better name. I don't think there's a better name. I wish there was a better name, because private duty nursing doesn't sound great. Most people don't know what that means, but the private duty part of it is the fact that Medicare does not pay for that. Mm-hmm. That's one of the key differences. So can you describe the nurse's role in each of these settings a little bit more?
Yeah. So as you mentioned, home health care, it's it's covered by your Medicare. And often you have to be eligible for that. A lot of times that is for individuals that are coming from an acute or subacute setting. You were just in the hospital, you were just in a skilled rehab facility, and when you go back home, you need a little extra care and oversight. And so when you get skilled nursing for that, usually what you'll see is you have a nurse that's going to come, your insurance is going to cover it. They're going to come probably once a week. They're going to visit you. They're going to do an in-depth assessment. They're going to see how you're doing. They're going to be able to make, recommendations back to your physician if you need additional support to prevent that cycle of rehospitalization.
Yeah.
That type of nurse is going to be more clinical. They're really doing an in-depth assessment and making sure that you're getting all of the care that you need. If you come home with dressing changes, they may do that as well. It really depends on what level of need that you have, but you're going to have that clinical oversight from a nurse for home health care. And then you have home services, where typically a nurse isn't required or isn't all that involved. At our company, we're really lucky that we have nurses, in our senior communities where we provide home services, as well as I'm not in a senior community, but I'm available to our staff for our home services clients. And a lot of that nursing support is going to be guidance and education. Because we're not overseeing those clients from a clinical nursing aspect, you're not going to be doing hands-on nursing, but you're going to be helping support recognizing change of conditions Giving advice on care plans and what additional care or pulling back the care may be needed if they're improving. And then you've got the last most confusing one, private duty nursing, which often gets confused with the home health care. Private duty nursing, as you mentioned, is not covered by insurance. It is, private pay. But we often work in conjunction with home health care to provide services under that. So like home health care in private duty nursing, you're going to see medication management. You're going to see dressing changes that the nurse may do, maybe insulin injections or monitoring, or something as simple as, an in-depth monitoring of vital signs, because that's something that can be, a factor that you're monitoring depending on your diagnoses. There. Hopefully that wasn't too confusing.
No, well, that was great. It was a great explanation, and it's a confusing topic. And I'll give an example that might be helpful for some of the viewers about when private duty nursing would be needed. Because a lot of the question comes up is if I have Medicare or insurance and that covers it, well, why would I need some additional nursing services? And one example is, everything that a nurse does is under a doctor's order. So that's part of the healthcare system. Mm-hmm. And if a doctor orders, I can think of a scenario where a doctor ordered that one of his patients needed wound care 6 days a week. And it was just a difficult wound. It wasn't healing. But Medicare would only cover 3 days a week. Mm-hmm. And so that was an example of when the company hired Open Arms and had nursing come in those other days to make sure there was adequate nursing support. So that's one example. So let's talk about you touched on it already, but what are some of the things that, actually, there's some questions piling up here. So let me make sure I get to these questions, because we're almost out of time. I told you this would go by fast. So one viewer question was, what would you recommend for anyone who wants to get into nursing later in life?
I've got 2 recommendations. The first one is, if you're not in the healthcare industry already, start with a CNA program to really make sure that you like it. A lot of nursing schools are going to require you to have a CNA degree to begin with, which is a certified nursing assistant degree. That's usually a quick several-month program, like 3-month program that you can do, where you're learning to provide, support for those activities of daily living. After that, if you are later in life and you already have a bachelor's degree, there are a ton of second degree nursing programs that shorten it because you already have a degree. Or maybe you're starting out with one of those shorter degrees. You're going to do an LPN or just that RN. That's a 2-year associate's degree, where you still are able to practice, but it's not such a large commitment for you school-wise.
That's a great recommendation, in my opinion. And I will just add that one of the things I'm so proud of is there have been several now nurses or about to be nurses on our team that started as CNAs, or caregivers. Caregivers then got their CNA, realized they loved it, had a passion for it. And like our own Katrina, who's about to, going back to school, she started as a caregiver with us, and she's going back to nursing school, and that's incredibly exciting for us all to see, for me to see. There was another question here I want to make sure we get to. What do you consider the most challenging part of nursing school, and what kept you motivated to hang in there and finish?
Yeah. I think the most challenging part of nursing school is the pace of nursing school. You are learning a ton of knowledge at once, always being quizzed on it, and you have to be ready to go. So it's an intense program. What kept me going was, one, I loved what I was learning about. So even if it was a lot of work, I really had a passion for it. But also there's an end in sight. I knew that once I got to this point, all of that studying I would be able to put into action and be able to use that degree. So I just was always running my marathon to get to the end of that finish line of boards and being able to practice.
That's great. You had a clear eye on the end goal. So.
I tried.
Another viewer question. What are the most important lessons you learned in your career? What advice do you have for someone who's considering going into a home health nursing?
Most important lesson that I've learned in my career is that nursing is collaborative. It is not just you caring for your patient or your client, but you are working with an entire healthcare team to ensure the health and safety of that individual. So really being open-minded to working with every type of individual, and always looking out for the best interest of your patient or client. And then someone considering going into home health nursing, my best advice would be that you learn this in pediatrics as well, but that you're not just caring for the patient or the client, you're caring for the whole family. In home health care, you are working with the adult daughter, the adult son, maybe a grandkid. And so you're not just educating one individual, you're, educating a whole family, you're supporting a whole family. Ultimately, that's coming around this one individual that you're caring for.
Yeah. I'm so glad that you mentioned that. And I will, as we're winding down on time here, I wanted to mention to you, as you said that, what motivated me to start a home care company was the experience I had with my mom. And one of the things that I will never forget along the journey were certain people that were remarkable in helping my mom and our family through that. In the very end, in the last several weeks, my mom was in hospice. And I don't know if we're going to have a whole lot of time. We'll touch on hospice. We should. But the compassion and the caring that the nurse in particular, I'll never forget her, showed my mom and our entire family was extraordinary. It was authentic, and it was so needed and so appreciated. So great advice. So we just have a couple minutes left, and I'd like to touch on a couple things here. Why is nursing support so important when managing care for individuals with clinical diagnosis in the home in particular?
Yeah. So clinical diagnoses are you're going to be looking for a lot more to alert you for signs that there may be a change. And as we mentioned, nursing school is super intense. You learn a lot about the physiology, the anatomy, and how things change. So being able to have that clinical understanding allows us to support those clients and notice the fine changes that are the start of something more. Where we're not waiting until it's really bad and they're going out to the hospital, but a nurse is able to identify that early on and hopefully keep the client safe in their own home with providing, additional care there.
Yeah, it is so important. And hospice care, I referenced hospice care. Just what is your what's the role of nurses in hospice care?
Yeah. A lot of times our nurses that we have, especially in our senior settings, work hand in hand with hospice. A hospice nurse isn't going to be there every single day. They're there to help educate a family so they can support their loved one with confidence independently, because that nurse can't be there all the time. And so, our nurses are able to add an extra layer because often they're in the community. So you get more more clinical checkups from, our nurses that are overseeing, your caregiving services. At our company as well, the nurses' role is to also make sure that our caregivers are working within their scope. You had mentioned that, we have a license that we do have to follow. So blessing and a curse, but we always have to work within what we're allowed to do. And so, caregivers can only do so much. Sometimes if hospice can't be there, they're going to use our nursing services as well to provide that clinical nursing care and oversight.
And just so everyone knows, because not everyone here might know what hospice is. Can you describe what hospice is?
Yeah. So hospice is going to be that end of life comfort care where we're no longer, treating a diagnosis to cure it, but you're providing care to make sure that that individual is comfortable through the end stages of their life and that transition. So, as you mentioned, hospice nurses are very special. It takes a very unique type of person that is able to care for somebody as they're going through that transition and support that family. And so it's beautiful when you're able to experience that yourself with a loved one and have a nurse that can do that.
I completely agree. And we're out of time.
That went fast.
It does. When there's a really great conversation, which this, in my opinion, was. Thank you, Rachel. It was so much fun to have you and have an opportunity to feature you on this Facebook Live. Thank you for everything you do. To any of the nurses that are out there that are on Open Arms team, or any nurses out there in general that are watching, I truly admire what you do. Thank you for what you do, and thanks for everyone who's watching. Thanks, Rachel.
Thanks.